Good morning and welcome to the Windsor-Essex County Health Unit's media briefing for Wednesday, November the 24th. We're joined by CEO Nicole Dupuis and our interim MOH, Dr. Nessa Thury. We're going to start today with some opening remarks from Nicole Dupuis, and then we will move into some media questions. Thank you very much.
Okay, am I ready?
Yeah, go right ahead.
Okay, good morning, everyone. Thanks for joining us again. So you've heard us say this before, but with the colder weather and winter holidays, we anticipate there will be more travel, certainly indoor gatherings, and more time spent in indoor public settings. With that, this time of year comes an increase also with usually illness and respiratory viruses. As we have more activities and indoors, as well as some of the changes related to border travel, we want to remind residents that it's important to still think about our public health measures. They continue to be important for reducing the spread of COVID-19 as well as other illnesses. And that includes staying home if you are sick, regardless of symptoms. If you're sick, stay home and seek medical treatment where appropriate. Maintain 2 meters distance from individuals outside of your household wherever feasible. Wear a mask in public settings when you're unable to maintain physical distance. Make sure individuals, continue to wash your hands and keep all of those practices as well. If you are coughing, make sure that you're covering your cough. And you've heard us say these for close to 2 years now. In addition, getting your COVID vaccine will significantly strengthen your protection against the virus. So if you still have not gotten your vaccine, we really do encourage you to go and get your first or second dose. And those are still individuals who have not gotten their vaccination are still eligible for a walk-in for first or second dose. We know tomorrow marks American Thanksgiving. Given that we're a border city, many of our residents, this signifies the kickoff to the holiday season, which includes, more family gatherings and more indoor activity. We encourage everyone to stay local as much as possible and limit your travel where feasible. However, we know with families on both sides of the border or in other places, people may want to get together. And so to make sure that you're reviewing vaccination status and keeping your contacts as small as possible wherever possible. We encourage folks as we move forward into the holiday season to continue to watch our website for current restrictions, general advice on gatherings, and information for individuals who are hosting any type of event. And you can find that at www.wechu.org. That's it. We'll take questions.
Thank you so much. We'll take questions starting with Windsor Star.
Yes, good morning, Nicole. Good morning, Doctor. For either of you, have you been noticing during case and contact management when your teams are speaking to individuals who have tested positive, are they saying that they no longer follow public health measures? Is there any change in people just saying, oh yeah, we were just attending a party with loads of people, no physical distancing, that kind of thing?
Well, I think that we do have clusters of cases that are associated with social gatherings. I think subjectively people are weary. It's been, in all honesty, it's been 18 months, 19 months of restrictions, and people by nature are social creatures. And so we are seeing clusters of cases among people who gather for social gatherings. We're also seeing clusters associated with other clusters. So exposures in school leading to cases, where those cases leading to recreational athletic events, and a cluster there, and that leading on to a party or another social gathering. We have seen exposures at weddings. So yes, I think that one is that people perhaps are not as vigilant as they might have been at the beginning of the pandemic, and we just have to work to keep our vigilance up. I also think that if people are going to gather or travel, that they should just take all the necessary precautions. which Nicole had enumerated just previously.
Thank you.
Any questions from AM 800?
Yes, good morning. Just wondering how the first couple days of the youth bookings for vaccines have been going, if you guys are encouraged with what you've seen, and maybe if you're planning similar blitzes to previous way that you've been doing things for this age group, or if it's, again, working well.
Thanks for the question. So I'll start, and I'm sure Dr. Nasseri will want to add. So as you know, bookings will begin or open up tomorrow. We did open up our booking site as well as our call center right away, so that individuals, who are interested could book as soon as possible. We are encouraged by, I think, the engagement. I don't have an exact number of bookings, but we are seeing parents book their children in, and so we are encouraged by that engagement, both with our booking, like online, and our call center. As well, we certainly have received a lot of calls and questions, and I think, again, that's encouraging. It shows interest and willingness for, in vaccination. We'll probably have more to share as we roll on, just to see, how well things are going as it officially, we officially kind of start tomorrow.
So the burden of illness, the burden of COVID has disproportionately affected young people. I think in this academic year, I think we're now approaching 500 cohorts of young people that have been dismissed. So if there's 20 students in a cohort, that's 10,000 children have in some way been affected by COVID in this academic year alone. If we get vaccination rates up among school-age children, especially this new group of children that are eligible, that will go a long way in preventing the number of cases in schools, which I think will be a positive. I also think it'll potentially give us opportunities to scale back some public health measures. If we can get to the rate where and it's doable for sure, with polio vaccine, I think we're at 92%. COVID vaccine is quite a bit less among school children. If we can get up to that higher rate of vaccination, we may be able to scale back on the extent of public health measures as it relates to schools. The second issue is that vaccines are safe and they're effective, and the risk benefit at this juncture is clear that the benefits outweigh the risk. We would encourage everyone who's eligible for vaccination to get vaccinated. They're not only helping themselves, because they're less likely to get sick if you're vaccinated, less likely to get infected, less likely to be hospitalized, and less likely to die, but you also help others because you help stop the spread of COVID from person to person to person. I do think the young people who come forward to get vaccinated, we use the metaphor, they are the superheroes. They are, because here we have children willing to get vaccinated, and we expect lots of them to do that. And in part, the reason they're getting vaccinated will help people who choose not to be vaccinated, who are in their 50s and 60s. And so I think we got to continue to work on encouraging vaccination. The health district, the hospital, the medical staff, I think are all working diligently to try to encourage vaccination among the newly eligible group of children.
Thank you. Any questions from CTV?
Yes, good morning. How does it make you feel that there are protests planned for the first day of children's vaccinations?
Sure, maybe I could comment on that, and then Nicole, if that's okay, Nicole.
Yeah, absolutely.
So I guess a couple of things. One is we live in a free society, and the peoples have every right to articulate their disagreements in a civil manner. And secondly, the Public Health Service historically has welcomed dialogue. This goes back right to the very beginning, because we recognize we have to balance many competing interests to advance the public health. But my concern is this: how one conducts or articulates their disagreements or conducts a protest has to also consider the effect that it may have on the people who are going to be exposed to some of the activities. So I'm particularly concerned, and we're all parents. We all have children, or we all have nephews or nieces, or other young people we care about. Or holding a protest in front of a public school, or holding a protest in front of a vaccination center where we have young people and older people who are trying to just advance their own health, I don't think is a proper way. I'm talking from my own perspective. Is not the proper way to articulate their disagreement. Disagreements can be articulated in civil manner, but also have to recognize who the people are going to be affected. The parents who bring their kids to a vaccination center or to a doctor's office or a school should not have their children face additional psychological stress to have to walk through or walk by people who might be expressing a political view or an adverse view to the decision that family has made. And so there's where I think the distinction has to be made. I'm sorry for this long-winded response, but we accept that people may disagree with public health policy, public health practice. We've always accepted that in the public health service. But as it relates to children and people who've already made a clinical decision, their decision should be respected, and they should not be impeded in making that determination. Nicola, I don't know if maybe you can supplement my comments. So.
No, I think you've said it really well. I wouldn't have anything additional to add to that. I agree.
Okay, thank you. And we've seen reports that there are some people who are planning to try to take up the booking spaces so that other parents can't book them for their children. What measures are in place to prevent false bookings of vaccine appointments?
Thanks for that question. So, we'll continue to monitor activity. It's certainly disappointing to hear, that we monitor our bookings. We will verify bookings if necessary, which means we may follow up with people who have booked. There are a number of sort of safeguards on the website that make it, a little bit more cumbersome, I suppose, for someone who is just trying to book and put in information that isn't actually correct or factual, or they're not actually interested in booking an appointment. So, we have put a few things in place. Keep in mind that it makes it more cumbersome for the individuals who truly do want to, book their vaccination appointment. But so we're doing our best to put what safeguards we can in place, and then we'll continue to monitor, and we may as well follow up and verify appointments. And it does take extra resources for us to do that, but we want to ensure that there's accessibility. The individuals who, as Dr. Nasathuri said, have already made that choice and are interested in wanting their children to be vaccinated to protect them and our broader community or their family. We want to make sure that it's as easy as possible for them. So we'll continue to monitor and continue to do what we can.
Yeah, I would also share this, regardless of how you feel about public health policy, vaccine policy, inappropriately using a public resource to impact people that have a different perspective, or otherwise trying to just get their health services, is not proper. That's different from disagreeing with public policy, when everyone is entitled to disagree with. And so I think that in the first instance, we would monitor if in fact this is happening, and if it's happening, then we'd have to put in additional measures to prevent this from causing disruption to providing an important clinical service. So I think that would be our approach moving forward. But I think we're going to do everything we can to make sure that that young people who are eligible for vaccine and their parents who want them to get the vaccine will get the vaccine, and other health services they might need down the road.
Okay, thank you.
Any questions from CBC?
Yes, a question about the recent data. As of yesterday, only 19 out of the 340 active cases were deemed to be variants of concern. Is there a backlog on the processing of these results, or does that accurately reflect the presence of variants?
Yeah, we can have our epidemiologist comment on that, but the vast, I think the latest evidence is that the vast majority are Delta variant at this point. The ascertainment of the variant is important, but it doesn't really substantively change our public health management at this point in time. If you send an email to us, we'll give you the data because this is a highly technical issue. When there's a positive case, it can be arbitrated as variant of concern or not a variant of concern, or the data is still pending. So we can go through the last, group of cases and give you an exact number. But the last time I spoke to my epidemiology resource, virtually all the cases are Delta, but we can verify that and get back to you.
Thank you. And is there any update on where the new vaccine supply is physically at this point, and how many doses are expected in the coming days? Go ahead.
So Nicole, why don't you talk about the local context, and I'll supplement that if it's appropriate.
Yeah, I don't think we can. So we know, again, we're expecting our vaccine supply. I couldn't tell you exactly sort of where it is. And I'm sure Dr. Nesathouri will say that we have been assured that we'll have, enough vaccine provided to us locally to, cover our population of youth 5 to 11, at least for that initial dose. So I don't know if you want to add, Dr. Nesathouri.
We can try to get you the exact number, but my recollection from a recent meeting was the province had ordered, I think, 1,070,000, more than 1 million doses of the vaccine for children. If you look at our current inventories, I think we have 30,000, more than 30,000 vaccine doses for adults in the health district, for adults and people over 12. So I don't anticipate supply shortages being the issue in the vaccine rollout for young people. I think it's that as we have people being booked, we should be able to vaccinate them. Windsor-Essex in a pretty good place because it has, I think, and we can give you the exact numbers. We don't want to tell you numbers that are not perfect, but I think we can vaccinate just at the community vaccination centers, or otherwise known as mass vaccination centers, 1,800 people a day, plus the channels through physicians' offices and pharmacies. We should be in a good position to have a multi-channel distribution of the vaccine. But I'm not at least at this point, I'm not concerned about vaccine supply being the rate limiting step.
Thanks very much.
Any questions from Blackburn?
I have two actually. The first one being, again, going back to that protest that is planned for tomorrow. I guess, do you have a message for the people working in that vaccination clinic that may be faced with this?
Yeah, most of the people who work in hospitals and at vaccination centers in the public health service are professionals. So they understand that there's always some level of complexity in their jobs. And so I think at a pure academic or level, they understand that people have the right to protest, and that we should allow people to articulate their disagreements in a civil manner in the proper framework. That being said, the people who have also worked in many of these centers have been working almost without break for 18 months, some of them. And so I can imagine that, I can just speak for myself. It would be stressful for me if I had to come to work to do an essential activity, which is treating people who need medical treatment, and having some people engage in activities that appear to be disapproving or challenging your integrity, or so I think on a human level, it's not the best approach. Secondly, picketing or protesting at a hospital is distinct from picketing and protesting at other places. A hospital is supposed to be a sanctuary for sick people. That's his first and most important role. And I'm sorry I'm speaking so boldly on this. When people go to the hospital, they have cancer, they have leukemia, they have lymphoma, they're coming for surgery, they're bringing their child into the hospital. That's stressful enough. To have a protest at a hospital or at a clinic doesn't achieve, it only causes psychic stress to the people who work there and to the people coming there for treatment or coming there for essential services. So I would say to the protesters, you like all people have family, children, find some other venue to articulate your grievances beyond where people are getting medical treatment. And for the most part, the people coming there aren't the decision makers for many of these policies. They're not the decision makers. So anyway, I am very concerned. We affirm their right to dissent, and I don't think any of us would oppose. Everyone, I think, agrees to that. But I think that the way that the dissent is manifest and the way the protests are manifest should be circumspect and should consider the consequences to people that are completely are coming there for medical treatment or who aren't decision makers in public policy. My apologies again for speaking at length on this.
That's no problem at all. Also, parents with kids at St. Gabriel, I'm sure they're going to be eager to hear if the school will reopen next week. Has there been, I guess, any discussion? I imagine there has been discussion about it, but can you give us any indication whether that school will reopen next week?
Yeah, and again, for being long-winded, the goal is to try to keep public schools open for instruction. That is the number one priority from my perspective. It's more important than almost all other priorities that we have in health or in public health. The way to do that is to, number one, to minimize the number of people who have COVID in the community. If 0 people in Windsor-Essex have COVID, it can't make its way to the school. That's not realistic. So then the next is to screen before people get to the school, so that if they are sick or that they don't make it into the school. If there's a breach of COVID into the school, then we want to identify it as early as possible and contain it to a class. And if it's made its way to multiple classes, or we have signals, we have epidemiological data that it's likely to spread, then we have to take more assertive action. And working with the school board, we try to do our very best to contain it. Closing a school can be an effective way to effectuate containment, although we do that with a lot of circumspection. With regards to the incident case, we have to wait for the data, and I think we're still waiting for the data to make a final decision. And there's a secondary aspect, is operating a school is just not COVID. It's also the administrative and organizational aspects of running the school. Do you have enough teachers? Do you have the ability to organize a school day? Can the young people be provided a good program? So it is complicated when to reopen a school, but we'll continue to evaluate that. And as we know more, the school board, I'm sure, will share that with the community.
Thank you.
Do we have any additional questions from Windsor Star?
Yes, on the topic of individuals looking to sabotage the booking system by booking appointments they don't intend to follow through on. Previously, when a new group was eligible for vaccination, the health unit, the hospital held a certain number of appointments for the new individuals and those who were previously eligible. Do you know if that's the case now, that a certain number of appointments will be reserved for 12 plus first and second doses, and other appointments reserved for the 5 to 11 age group?
I'll ask Nicole to respond to that because she's more facile at the operational issues.
Yeah, I'm here. I apologize. I lost my video. Yeah, so I guess our answer to that is, yeah, we are working closely with obviously in collaboration with the hospital on as it relates to the mass vaccination site. We're confident in reviewing our capacity there, as well as the numbers of individuals that we're seeing, that we will, that there will be available appointments for 5 to 11 on a daily basis, and that, we don't anticipate or have any concerns at this time that parents who are looking to book won't be able to find an appointment, a reasonable appointment for their children. If we get to a point where we see concerns, again, we'll always monitor and we can make adjustments if needed. That could include, holding specific slots, et cetera. But at this point in time, we feel the capacity is there to meet the demand from the community.
Just one more question. Do you know if primary care providers, pharmacies, do have access to the vaccine for 5 to 11s yet? Or for now, is it just the mass vaccination site?
So all pharmacies and primary care are part of our, as well as our mobile sites, are part of the rollout. So the health unit, does work with primary care will fulfill, vaccine orders, work with them in supporting them to, deliver vaccine through their offices. So, in short, I suppose that's the answer, that they'll, it's not just the mass vaccination site, it'll be rolled out across all modes through all available sites at the same time.
Okay, thank you.
Any additional questions from AM 800?
No, I'll get everything I'm looking for. Thanks.
Thank you. Any additional questions from CTV?
No, thank you.
Any additional questions from CBC?
Nope. Have a great day.
Thank you. And any additional questions from Blackburn?
Nope, I'm good too. Thank you.
All right. Thank you, everybody. So just a reminder, we will not have a live briefing tomorrow on Thursday. So we'll reconnect on Monday, November the 29th. Have a wonderful day.
Thank you.